Hi everyone, this is Professor Nicholson lecturing on obesity, protein, calorie, malnutrition, and factors affecting nutrition. Please review the following subcompetencies on your own. Newborns and infants. This is a period of rapid growth and development. They have high caloric requirements, so approximately 100 calories per kilograms for infants versus 40 calories per kilograms for adults. Large portion of total body weight for newborns and infants is equivalent to water. They have a high fluid intake requirement and they can get easily dehydrated. Newborns and infants' initial nutrition. For the best health outcomes, the American Academy of Pediatrics recommends exclusive breastfeeding for approximately 6 months, followed by continued breastfeeding with complementary foods. To note, cow and other milks are poor sources of adequate amounts of iron, vitamin C, and vitamin E for that first year of life. Why? The concentration exceeds the ability of immature kidneys, and the digestive system cannot adequately digest those milks, which leads to diarrhea, intestinal bleeding, as well as malnutrition. We will focus on breastfeeding and benefits next semester, but it's important to understand what PDHM is. PDHM stands for pasteurized donor human milk, which is human breast milk from a donor that has been screened, pasteurized, and frozen for use in feeding infants and newborns, especially those who are premature or medically fragile. It's used as a supplement when a mother's own milk is insufficient or unavailable. It serves as a bridge to help newborns and infants avoid formula and get the benefits of human milk, while their mother's supply is established or their own milk is more adequate. Evidence-based benefits of PDHM. As compared to formula-fed newborns and infants, breast milk is protective against respiratory illnesses, ear infections, gastrointestinal diseases, as well as allergies including asthma, eczema, and atopic dermatitis. The rate of sudden infant death syndrome, also known as SIDS, is reduced by over a third in breastfed babies. 15% to 30% reduction in adolescent and adult obesity has also been shown. Newborns and infants formula feeding. Formula is roughly approximate to breast milk in the percentage of nutrients. They both also provide approximately 20 calories per ounces. Formula is highly processed, and there could be different protein bases used. Nutrient content is regulated by the FDA based on recommendations by the American Academy of Pediatrics. Newborns and infants solid foods. There's lots of controversy about what to start with and what order to go in. Baby-led weaning involves jumping straight to finger foods at this time and bypassing those purees. There's also controversy about homemade versus store-bought. Parents should do what is best for them and their family, right? You need to know supplementation of breast milk and or formula with solid food begins around 6 months of age. Also to note, there is a choking risk during this time period. Parents are recommended to provide pureed or finely diced foods. They should avoid small, hard foods like nuts, grapes, raisins, as well as raw carrots. However, cooked, diced carrots are appropriate. Toddlers and preschoolers. Caloric requirements decrease from infancy, but are still higher than adults. Iron supplementation may also be needed. Calcium inhibits absorption of iron, so know that milk is a poor source of iron. Calcium, vitamin D, is needed for bone growth and development. Choking risks continue to be a risk for this age group, so ensure parents provide finger foods that are cut small. It's also important to establish good food habits, such as allowing them to eat only when hungry, stop when satiated, limit juice, offer healthy snacks, avoid food as a reward, offer choices of wide variety of textures, colors, and tastes of healthy foods. Developmental challenges also begin around this time, such as their assertion of independence. School-age children. Growth becomes slower and steadier than previously. Lunch is no longer parent-supervised, so sometimes food is thrown away or even traded. They may be less physical active while in school. Also, childhood obesity is on the rise at this time. Note that obesity is defined as a body mass index, so BMI, at or above the 95th percentile. Adolescence. This is the time of growth spurt. Protein, iron, calcium, and vitamin D are crucial and often lacking. To note, females often need more iron than males once menstruation begins. Also to note, calcium intake during adolescence has a critical role in bone health during the later years, so it's important to ensure that they're getting adequate intake. 25% of calories are consumed from snacks, and adolescents also eat away from home a lot more often. They also have a high rising obesity rate. It was about 5% in 1980 and then rose to about 20.2% by 2020. Influences on adolescent eating habits. They have increased independence from parents, leading to diminished influences, habits, and choices made from role model behaviors. In addition, they are seeking their self-identity. The need for peer groups is important, and it's on the rise. They feel the need for acceptance. Additionally, this creates a tendency for eating fast food or convenience store foods in their peer groups, or even following fad diets. Body image is also a focus for most, and they tend to focus on their appearance or are influenced by the media. Therefore, eating disorders such as anorexia nervosa and bulimia can become high risk for this age group. Experimentation also becomes prominent during this age group. They may try fad diets, like I mentioned, have alternative eating patterns, such as a vegetarian lifestyle. They also tend to take risks and take part in smoking, alcohol, and drug abuse. This, of course, can impact their nutrition significantly. Please take a moment to pause and do this pulse check. What nutritional components lack in a teenager's diet? This is a select all that apply. The answer here is A, protein, B, iron, C, calcium, D, vitamin D. These are crucial and often lacking. Young adults. Dietary habits set the stage for future health. Lifestyle changes also impact nutrition. This could include work limiting opportunities for physical activity, or living independently, needing to shop for yourself and prepare food. Also, strong advertising and social media influences can affect lifestyle and dietary habits. Parental role models and influences on nutrition is minimal for this population, and young women of childbearing age, you should know that it's common for them to have iron deficiency anemia and inadequate calcium intake. You also need to know that adequate folic acid, also known as folate, lowers the risk of neural tube defects by 70%. Pregnancy. Poor nutrition leads to low birth weight and increased pregnancy complications. Specific nutrient requirements during pregnancy includes the following. Folic acid. You need to know this. This deficiency is associated with neural tube defects. Folic acid pre-pregnancy requirements is 400 micrograms, and during pregnancy, it's about 600 micrograms. Calcium is also a requirement. The needs for calcium increase in the third trimester with the fetal skeletal mineralization. Iron. The need for iron increases as well. There's more oxygen-carrying red blood cells due to the fetus. And then protein. Maternal and fetal tissue synthesis relies on this. Lactation. For those that are unsure what this is the secretion of milk from the mammary glands in addition to the period of time that a mother lactates to feed her child. There are higher nutrient requirements than pregnancy during lactation. Typically, there's about 500 extra calories minimum. The mother typically needs more protein in her diet as well as extra fluids. Older adults. Their caloric needs decrease. Why? Because they have a slower metabolism overall. In women, they become postmenopausal, which decreases that need for those extra calories. And also, there's a tendency towards decreased physical activity with advancing age and physical disabilities, hence that decreased need for the extra calories. Overall, nutritional needs remain the same or are increased. There's actually an obesity paradox for this population. While obesity reduces functional ability and is associated with morbidity, after 70 years old, the mortality risks are actually lower. Why? This may be protective from injury and provide energy reserves during illness. Of course, there is a healthy and unhealthy weight gain to consider. Changes in nutritional needs for older adults. Baseline protein needs may be increased, especially for their healing and frailty. Fiber need also increases due to slower peristalsis and a possible decreased activity that can lead to constipation. Fiber improves glucose tolerance, binds with bile to cause excretion, and increases satiety. Changes in nutritional needs for older adults continued. Regarding vitamins and minerals, calcium needs increase with age. Supplementation, including vitamin D, may be advisable, but not the best source for adequate intake. Vitamin D is needed for that calcium absorption. Regarding vitamin B12, a deficiency in this can occur with age related to reduction in gastric acid and medication interactions. So, in summary, calorie needs decrease, protein needs may increase, fiber needs increase, calcium needs increase, and B12 needs increase as well. Hydration for older adults. The daily requirement is about equivalent to 1,500 milliliters of intake. Their requirements increase with physical illness, surgery, trauma, fever, and other physiologic demands. They're also prone to dehydration, especially with limited mobility, lack of bladder control, dementia, Alzheimer's, as well as those that live in high environmental temperatures, like those snowbirds. It's also important to note that older adults tend to have a diminished thirst sensation, so they tend to drink less. Also, some may be on diuretics and drugs that affect their fluid balance. Physical factors affecting nutrition in older adults. There is conflicting research as to whether decreased taste and smell is a normal part of aging. However, there are various reasons for that decreased ability, such as the condition of their teeth and gums. This may limit food texture choices, cause pain, and affect their ability to chew. They also may experience a dry mouth, known as xeristomia. This is due to lack of saliva production. It's a common side effect of many medications, such as those in the categories including diuretics, antihistamines, and anticholinergics. GI function and motility declining may also affect the taste and smell, as well as those chronic diseases that they could encounter. Socioeconomic factors affecting nutrition of older adults. The first factor is related to their finances. They're usually on fixed incomes. This causes them to make nutritionally poor food choices and not eating those recommended 3 meals a day. Unfortunately, sometimes they have to even pick between heat, medications, or food due to that fixed income. Another factor is the access to food sources. This could be due to transportation issues. Maybe they are unable to drive, or maybe there's not a local grocery store that's close by. And they also may have less of an ability to actually shop due to that energy decrease or mobility limitation, activity intolerance, and poor vision. And they may not even be able to carry their groceries into the kitchen. Another factor is a lack of mealtime socialization. Eating alone tends to result in disinterest in food or even overeating. Another factor is that inability to prepare food. As mentioned, that functional ability. Maybe they have a lack of knowledge or forgot. Or maybe it's just that depression or loneliness they might be experiencing getting the best of them. Lastly, another factor is their knowledge/willingness to adhere to special diets. This could be due to those on, sodium restriction or are diabetic. Regarding socioeconomic factors affecting all ages, this pretty much goes hand in hand with what was discussed regarding older adults. Other challenges for older adults include those that are hospitalized. They have an increased calorie need. They may feel poorly, which affects their appetite. They may have a lack of familiar food, and they also may have a lack of food and or water available on demand as they may be used to at home. They also may have an NPO status, so remember, that means nothing by mouth. And they may or may not have access to their dentures and eyeglasses. Other challenges for older adults continued include those that are in long-term care. Factors include them needing feeding assistance. This also may be an issue if there's not enough staff on the floor. They also may have a lack of familiar food. They may have an inability to access water or food on demand, such as at home, and they may have unnecessarily restrictive diets. The environment is not always conducive to eating, and they may feel a lack of dignity. It's important to know that you should make them feel at home. Allow food from home if able. Again, make them feel at home and allow food from home if able. Pulse check. What is a potential complication for an older adult who is post-op hip surgery and has a history of protein-calorie malnutrition? The answer to this pulse check is pressure ulcers. Common cultural/religious dietary practices. You need to know this. Regarding a Jewish kosher diet, they typically have no pork or shellfish. Dairy and meat are not mixed in the same meal or served on the same dishes, and symbols on food indicate kosher supervision. Regarding Islam, they typically do not eat pork and they do not drink alcohol. Regarding Hispanic, they typically eat rice, beans, fruit, and vegetables, and they have a very simple preparation. Regarding Asian, they typically eat rice, vegetables, and fish. They have little red meat or dairy, and they tend to eat soy. Lastly, regarding Mediterranean, they focus on fresh fruits and vegetables, grains, and legumes. Olives and olive oil are their primary fat source. They only have fish and poultry a few times a week, and they like to drink red wine. The following slide shows influences on eating habits. Pulse check. On your own, list common cultural/religious dietary practices for the following. We just discussed this. I would recommend making flashcards if that is more helpful. Technological nutritional innovations. In the United States, our eating habits and nutrition have been impacted by technology in numerous ways. This includes refined foods versus unrefined, processed versus unprocessed foods, preservatives to extend shelf life, supermarkets versus farms, and fast or prepared food versus homemade. The following slide shows effects of nutrition on health and disease. The following are disorders with a link to nutrition. For example, implications of obesity could lead to a stressed heart that leads to heart disease and/or hypertension. Obesity also limits respiratory function and stresses joints. Another example is the higher rates of cancer and those with restrictions of mobility. This could lead to DVTs and poor wound healing. Effect of chronic disease on nutrition. Regarding heart failure / COPD, this is associated with decreased appetite and activity intolerance, which includes eating, but increased energy expenditure. Regarding diabetes, this requires alteration of usual eating patterns to control. It's important to pay special attention to those complex carbohydrates. Regarding stroke, this may cause dysphagia or functional limitations with eating and/or drinking. Regarding dementia, cognitive awareness of need to eat and drink is diminished. Recall. What is the electrolyte, sodium, primarily responsible for? Well, it regulates fluid volume. Can you recall what other electrolytes are primarily responsible for? For instance, potassium, calcium, and magnesium. If not, I suggest you take a brief moment to look these up on your own. Effect of chronic disease on nutrition continued. Regarding cancer treatment, this is associated with increased caloric needs in the face of decreased appetite, decreased ability to consume or absorb adequate nutrition, as well as the side effects of treatment. Regarding polypharmacy, this is many medications that are prescribed. This can affect appetite, nutrition absorption, and the need for specific nutrients. Medications and nutrition. Diuretics influence serum potassium levels. For example, loop and thiazide diuretics can cause hypokalemia, so it is important to increase potassium in the diet. Another example is potassium-sparing diuretics. These can cause hyperkalemia, so high potassium sources of food should be avoided. Moving on to insulin. It's important to note that insulin requires carbohydrates to act upon. Regarding grapefruit and grapefruit juice, you should know that this inhibits absorption of many nutrients. Regarding alcohol, this interacts negatively with many drugs. And then continuing on, some drugs may be taken on an empty stomach, while some must be taken on a full stomach. It's important to understand the proper way to take these medications. The following are medication side effects affecting nutrition. Alternative food patterns include those that are vegetarian. This is a wide variation. You have ovo-lacto-vegetarians, which avoid meat, fish, poultry, but will eat eggs and dairy products. You then have lacto-vegetarians, which avoid meat, fish, poultry, and eggs, but will consume dairy. After vegetarian, we have vegans. These individuals eat plant sources only. It's important to know that alternative food patterns require careful planning to ensure adequate nutrition, especially protein and iron enriched. Body mass index, also known as BMI. This is a tool to utilize height and weight measurements. It's used to estimate health risks and provide recommendations for weight loss or gain. It's a screening tool, and it's simple and inexpensive. It does not measure body fat directly, but research has shown that BMI is correlated with more direct measures of body fat. Limitations of BMI include the fact that muscle weighs more than fat, and it's not gender specific. You need to know the different classifications within the BMI chart. The following slide shows the medical definitions of obesity. Between 2017 to 2020, the obesity prevalence was about 39.8% among adults aged 20 to 39 years old, 44.3% among adults aged 40 to 59 years old, and 41.5% among adults aged 60 and older. Causes/risk factors for obesity include caloric intake exceeding metabolic demands, a complex etiology, often multiple contributing factors, as well as principal causes, such as unhealthy eating habits and inactivity. Other causes include genetics, hormonal, disease states, quitting smoking, and medications. Causes and risk factors for obesity are related to aging, lifestyle, nutritional knowledge, economic status, family lifestyle, and learned behaviors. So as you can see, there are lots of factors that contribute to this. The following are effects of obesity on the body. It increases the work of the heart. It restricts respiratory function. It causes a chronic low-grade inflammatory state on the cellular level. It causes insulin resistance. It has stress on weight-bearing joints. And it also increases the risk of thromboembolic events, especially those that have a BMI over 40. And lastly, it compromises wound healing. Going a little deeper, this slide provides diseases associated with obesity. I know it has been talked about throughout this lecture, but it's important to know. Protein energy malnutrition is an umbrella term, as you can see on this slide. This includes inadequate protein and starvation. Caloric intake is insufficient to meet metabolic demands. So the BMI is less than 18.9. In developing countries, this is actually the leading cause of death for children. And in developing countries, it occurs in older adults and in younger patients with wasting disorders, GI disorders, or disorders that increase metabolic demand. GI disorders include things like pancreatic insufficiency, colitis, and removal of the large intestine. Wasting diseases include cancer, end-stage heart failure, renal insufficiency, COPD, as well as liver failure. And disorders that increase metabolic demand include burns, trauma, and infections. It's important to know health issues involved with protein energy malnutrition. Remember, protein energy malnutrition is an umbrella term as discussed. Pulse check. Which intervention would most likely help an older adult improve nutritional intake while hospitalized with a regular diet? The answer is D. Allow family to bring food from home. You should always determine that the diet meets nutritional requirements as well.